bringing together health and social care services. Redbridge Adult Social Services have been working with NELFT NHS Foundation Trust to bring together health and social care staff into single teams called the HASS, so that people can get better, more joined-up care and support. This is a new way of working, and lots of teams are involved. Smaller, joined-up teams have already been tried. For example, with the Community Learning Disability and Community Mental Health teams. As this is a much bigger change, a new legal agreement is being prepared to make sure that the system works properly. This is called a Section 75 agreement. When the teams are in place, we will need to check that the new service is making life better for people using services. It was agreed that the best way to do that would be to ask people if they had received a good service. We asked people what it is like now when they ask for help and what would make it better. The people we asked gave us lots of information. They said that some things were good, but other things needed to get better. We used that feedback to write down a checklist of measures that we have called I statements, which people have told us would show they had been given a good service. Now we want to ask if we have got these I statements right. We need you to tell us if we have missed anything important off the list, and if you agree that when all those things are happening, we can be sure that the new service is good. When we are sure that the checklist is right, we will ask people who have used the new service to tell us if it is better. We are asking people who use our services to volunteer to help us check that the service has improved and fill in a survey form that has the I statements on it. I statements, draft checklist. We are asking you to tell us if you think the list includes the things that are most important to you when using health and social care services, and if there is anything missing that you would like to add. 1. I get support that is right for me to make sure I know what actions I can take to improve my well-being. I am independent and feel part of the community. I can make decisions about my support. 2. I can access the support I need. Staff know how to help with my physical and/or communication support needs. I don't feel guilty about asking for help. I am listened to and treated with dignity and respect. I am in control and I know who to contact if I need support. I get an assessment that considers the needs of my whole family. I know my input as a carer is valued. I understand how long processes will take. I get help to manage my own health and support needs as a carer. 3. I know how to get good advice and information. I don't have to fight for information because it is easily available, and those providing information and advice know the system. 4. I know who my details will be shared with and what will happen next because staff talk to me and each other. I don't have to keep repeating my story because there is good communication between different agencies working with me. I understand whether I am entitled to have an assessment and what I will have to pay. 5. I know what to expect from services I am getting. I feel in control and supported to manage my own care. I am confident that the people who provide my care are reliable, knowledgeable, and trustworthy. I can get flexible support, and I know how to get help out of hours. I know how to report poor care without being afraid of the repercussions. Six, I can have a say in planning and monitoring future services. I can see the benefits of my involvement in planning future services. I agree that the list will show that I have been given a good service. Please tick yes or no. If you tick no, please say what we should add to the I statements. Bringing Together Health and Social Care Services HASS. Will you help us? We would like you to tell us what you think about the changes we have made to the services you use in the HASS and to invite you to other events as they happen. To help us keep in touch, please tell us how you can be contacted by completing the following form. About me. Name. Address. Please tick one box from the following. I am currently a service user. I am a carer. I am a member of the public that may need support in the future. I am a private or voluntary sector provider wanting to know more. My email is. My phone number is. I have support needs relating to my disability, impairment or sensory loss, for example deaf or blind. Please describe here what help you may need to take part. I'm involved with a voluntary group. Name of voluntary group and contact details. What is the best way of making contact with you? I wish to confirm that I am happy for the Council to hold my contact details on a secure website so that I can be contacted in the way I have described. I agree. Signed and date of consent. Getting involved. Please tick as many boxes as apply in the table. First row. Events and workshops. Preferred choice. May be useful. Not useful. Not sure. Second row. Surveys, questionnaires. Preferred choice. May be useful. Not useful. Not sure. Third row. Redbridge Eye website. Preferred choice. May be useful. Not useful. Not sure. Fourth row. Other. Please specify. Preferred choice. May be useful. Not useful. Not sure. please send completed forms to myview@redbridge.gov.uk. For more information, contact Julie Fanning, Executive Policy Advisor. Email julie.fanning@redbridge.gov.uk. Telephone number 020 8708 5167.